Give the patient a partial bed bath. Introduction. A partial bed bath, for the state test, requires cleaning the skin from face to waist, front and back. This does not involve the hair or anything below the waist, as these are covered under different skills. For the test, this skill will be performed on a female mannequin. The evaluator will play the voice of the mannequin for the skill. The evaluator will be available to stabilize the patient when you turn the mannequin on her side when cleaning her back. Since the mannequin is hard plastic, she will not remain on her side without assistance. When filling the basin with water, use a paper towel to turn the faucet on and off. Your hands will be clean and the faucet is dirty. And check the water temperature with the inside of your wrist. The water should feel warm, but not hot. Since this is a washing skill, you will need to ask the patient to check the water temperature to make sure the water is comfortable for the patient. The evaluator may test the water temperature to ensure it's comfortable. You will be touching private, personal skin during this skill, the breast area. You will want to wear gloves to make this skill more clinical and reduce the patient's discomfort. When moving breasts to clean, use the back of your hand, not your palm. You will need to keep the patient's bed dry during this skill. Place a towel under the patient's body part that you are washing. If the bed gets wet, do not ignore the wet sheets. Tell the evaluator that you would change the sheets at the end of the skill. Do not leave a patient in a wet bed. Privacy is important in every skill, but it is very important when performing skills where the patient will be uncovered or undressed. For these skills, we use a privacy blanket, also called a bath blanket, to cover the patient with while we perform the skill. We will use a special technique to wash the face, which uses different areas of the washcloth to prevent cross-contamination. This method should be used when washing any wet opening on a body, such as the eyes, nose, mouth, genitals, or anal area. This method uses a standard washcloth. The washcloth will be folded into fourths. The washcloth is then rotated so that the corners face upward. We will use the corners of the washcloth to provide multiple clean areas by using each corner only once. The washcloth will be held in a diamond shape and positioned in your hand with the folded point at the bottom of your hand and the free corners or leaves pointed upward. Tuck one corner between the thumb and the index finger and the last corner between the ring finger and pinky. You will use the leaves of the washcloth to clean the wet body openings. Using this technique will keep any infections from spreading from one area to the other because we are using a new area of the washcloth for each area. You will wipe away from the wet opening, then fold the leaf over, exposing a new leaf for the next area, repeating as necessary. Partial bed bath consists of washing the patient from face to waist, front and back. You will wash the face first with no soap, using the leaves method. Important points to consider here: wring out the washcloth well and keep control over the washcloth in your hand. Wash the eyes first from inner corner to outer corner, using a new leaf for each eye. During this skill, it is important to keep the bed dry by placing a towel over the bed under the body part you are washing. If the sheets become wet, do not ignore it. The patient will not want to lie in a wet bed. As you move to wash different body parts, move the towel to keep that area of the bed dry. Partial bed bath for the exam only requires washing the face with plain water, the neck, chest, torso, back, and one arm. You do not have to wash the other arm for the exam. Remember, the test just demonstrates that you know how, and you already did that on the first arm. Basic washing rules apply. Whatever you wash, you rinse. Whatever you rinse, you dry. And don't get the bed wet. A demonstration of washing techniques for partial bed bath. You will first wash behind the ear and the neck, then the entire torso to the waist, moving the breast up with the back of your hand, the side of the torso, the top and bottom of the entire arm closest to you, and the armpit last. When cleaning the mannequin, you will not have to move the breasts because they are hard plastic and do not overlap the skin of the chest. But in a clinical setting, this will not be the case. You will need to lift the breasts to clean underneath. Use the back of your hand to lift the breasts, not the palm of the hand. This makes it more clinical, and the patient will be more comfortable. Water in the basin should remain clean for rinsing. Therefore, we do not put soapy washcloths back in the basin after use. Basins are no soap zones. Soap is put directly onto the washcloth, not into the basin. After washing, the soapy washcloths will be set aside. Rinsing washcloths, however, can be returned to the basin to remain warm for future use. After washing, rinsing, and drying all areas on one side of the body, you will dress the patient in a clean gown. An important point: maintain privacy throughout the skill with a privacy blanket. Remember, you only have to wash one arm for this skill, but you still need to dress the second arm. The patient should be asked to scoot their body toward you and roll away from you toward the center of the bed. This ensures the patient is always lying on their side in the center of the bed with their back toward you. You will have to move the mannequin. The mannequin is hard plastic and will not stay on her side without assistance, so the evaluator will have to be asked to hold the mannequin stationary as you clean the back. Remember, you cannot depend on side rails during the exam. Just ask the evaluator and they will hold the mannequin while you clean. Here's a safety tip. Only wash what you can reach comfortably. Never reach across a patient for any skill. If you lose your balance, you will extend your arms to catch yourself. This is a reflex and can't be stopped. Since the patient is directly under you, you will be accidentally falling right on top of the patient, which could cause serious injury. It's always best to move to the other side of the bed instead. Warm lotion in your hands and give the patient a short back rub to stimulate circulation. Starting at the waist, travel upward in small circles until you reach the shoulders. This should be done 3 times. Always wipe off the excess lotion after applying. Tie the gown at this time. Now you're ready for the closing. You must have gloves on to dispose of your linens and clean your supplies. Return the patient to her back in the center of the bed and make sure she's covered with a blanket. Then you can dispose of your linens, disinfect your basin, and clean your work area. You should not touch the patient's sheet with your soiled gloves. After you remove your gloves, take the privacy blanket off and replace the top sheet over the patient. Perform your closing and wash your hands. Watch the instructional video for step-by-step instructions on how this skill is performed. Then try the skill on your own.